Good morning, everybody. Looks like it could be a very beautiful weekend. We got to be ready because Miami is the city. Everybody is getting here and it's becoming so beautiful, so great. And I'll tell you something, I live in Coconut Grove. You know, it's impossible to find a house in the Grove. It's unbelievable. Before they're listing, there are even fights to getting things in. Or people are buying houses that are not perfect, going in and spending 50, 75, 150, 200,000 to fix them up to make them like they want. Well, today it's interesting. What we're talking about is, would you believe, getting care after a car accident when no one wants to treat you. But today we're going to go into an interesting piece. This is the dead body. It's a dead man, the body of a dead man on a woman. Would you believe it? Only Dolly could do it. It's called the Pietra. Now, a little information is there. This is a beautiful and classical, clearly inspired by Michelangelo's famous piece of the name. The Pieta, 1498 to 1499, is a masterpiece of Renaissance sculpture by Michelangelo Buonarroti, and it's housed in St. Peter's Basilica in the Vatican City. It is the first of a number of works of the same theme by the artist. It was commissioned by the French Cardinal Jean Billinares, who was a representative in Rome. The sculpture was in Carracin marble, was made for the cathedral's funeral monument, but when it was moved to its current location, the first chapel on the right as one enters the basilica. In the 18th century, it is the only piece of Michelangelo ever signed. And it depicts the body of Jesus on the lap of his mother, Mary, after the crucifixion. Well, we know Dolly does his religious pieces, whether it's Christian, Judaic, Muslim, whatever, but it's such a classical, beautiful piece. And it's really so encompassing, and it just gets to you that it's such an incredible piece. And it's been sitting there in my living room for many years, and we just pulled it out to show it to you so you could see it. And it's really, we had to even clean it up because it was so dusty, and it still has some dust and stuff in it. But what's interesting is yesterday I had a woman call us up the day before, and she was almost crying. She was in a serious car accident where the whole front of her body was sore and a little back pain. And she came in, and I saw her because she was very concerned about coming in, and I brought her in from the waiting room into my office and to give her some special attention because she didn't understand why no one would want to treat her. And it's kind of interesting that no one would. And we were there to take care of her and to treat her. And it's interesting that we're there. So when she came in, she said to me, Dr. Burak, I called 12 different doctors' offices. I told them I was in a serious car accident and they wouldn't treat me. Well, finally, after the 12th one, I called up Baptist, and would you believe they told me to call you up to see you because you would see me. Well, this woman was in severe shape, and before I even saw her, we had to bring her up to our neurologist just to double check. And it's basically just trauma from the airbags and everything that exploded and hit her and burnt her arm some. But she also had some pain in her back and her neck. And we know that once those soreness in the front of her body goes away, she's going to have all sorts of stuff. And she might even have a traumatic brain injury. And also what was crazy too is she had children 14 and 16. She brought them to the pediatrician, and the pediatrician said they had no broken bones. I said, wait a second, did they take x-rays? She said, no. I said, well, you can't really be sure they didn't have broken bones. Well, yesterday morning, after ringing to the pediatrician the day before, she had to pick them both up at school because they were in such severe pain. And I told her, hey, listen, we're there to help people. I don't care if you're a child, you're an adult, whatever age. We've had children that were 12 with herniated disc, kids that were 10 with shoulder cuff tears or rib tears in their knees. So it doesn't matter what age you are, we at Affiliated Healthcare are there to help you. And you've got to remember too, we have all our doctors. We have an orthopedist who's board certified in extremities, including hands, which is impossible to find someone to treat you for accident for hands because they don't want to get involved in accidents. They don't want to deal with attorneys or the courts or trying to collect the money. And it is amazing, but we're there. Of course she had multiple CT scans, she said x-rays, she had everything. I said, listen, rather than us, we taking the exams and the testing, we need you to get your tests for us. Get us a copy of the reports, which she had with us, and I said, get us the films, because I'm going to let our doctors review them to double check. Not only that, because of the serious nature of some of the things on the front of her, I'm going to send them to our radiologist. At the hospitals, when they're reading mass number of x-rays, you're never sure. There's so many times they miss things. So we're always at Affiliated Healthcare to make sure we double check to see what's going on. Plus, when they do CT scans, it's not, CT is better for bone, not for disc or for tears in the ligaments or tendons. So that's what we do with the MRIs. Good morning, everybody. We got a few people watching. Fran Miller is watching. Rebecca Fitt is watching. My buddy Dr. Andrew Schmier is watching. And Fran Miller says, only the surgeons, all I want to treat is surgeries. So, and if you don't need surgeries and you can't see a broken bone, what are they going to do for you? Well, people don't understand that we need care. Boy, also join us is an old fraternity brother of mine, Dan Simpkin. Dan, it's good to see you still hanging around with us. I'd love to hear from you, Dan. Really. You know, also too, Dan, you, and any of my friends can always call me on my cell at 305-389-9513. And everybody's saying good morning and how you doing, and it's kind of really cool that we can do it. And it's interesting. As time goes on, we're there to help. But with this woman, it's going to take us some time. And I told her we're going to have to just take time. Because of what's happening on her front, she's probably going to use a lot of ice to try to help to take down the swelling. I'm also concerned that with her, maybe her breast, she might have had some trauma to that. She might need to see our plastic surgeon, also the orthopedist. We can also do MRIs once we determine things settle down a little. But you know, when you're hurt, you're seriously injured, and people don't want to help you, what are you going to do? Hey, that's why Affiliated Healthcare is there. Also, another old buddy of mine, Neil Marinoff, is watching. It's kind of interesting. When you're injured and you're hurt, and people say, oh, you look fine. There's nothing wrong with you. Well, that's when that pain is so severe. This woman was like crying. It just, you looked at her in the way she was sitting. But that's what's so good with us, because we're going to take care of you. Hey, we have all our therapies. We have electrical stimulation, hot packs, ice packs, ultrasound, myofascial reliefs. We also have lasers. We have active physical therapies. Whatever people needed are there. We also now have physical therapists. So sometimes too, when our orthopedist sees people for extremities or surgeries or rehab, they're going to need to see just someone to take that special area, and they do that. So we have a combination of therapists for whatever is needed. We do have also some licensed massage therapists, and they do myofascial release. And that's the kind of treatment that we can and do give, so it can be soft tissue. And it's amazing how patients say, Dr. Burek, I like that therapist. Another one says this therapist, and says, well, this one works me out so hard, I like that. Other one says, this one's so soft, and that's how I like it. But when it comes to therapies, patients kind of get attracted to one or the other of our therapists, and they love the way that they take care of them, treat them, and handle their physical problems. Because each person's different. Each injury's different. You know, sometimes you can see them. I'll have patients that'll come in. I see this one patient one day walked in, and he was such in distress as his knee. We did our exam and x-rays. We sent him right out for an MRI, showed there was severe tear, and sent him right over to an orthopedist for surgery. So we did that right away, because if someone has something that is that bad, they need to be taken care of immediately. And when you go to a lot of these doctors, get in line, wait for hours and hours to get seen. People have told me they've gone to doctor's office and waited 2 to 6 hours to be seen by the doctor. That isn't going to happen in our office, that's for sure. If it did, I'd kill my staff and doctors. But I don't have to worry about it, because it never happens. Yeah, you might be a few minutes. Hey, you might have an emergency come in to see him immediately, but we're really lucky. We've really geared up their staff. In our surgical suite, we've hired new assistants. We hired a nurse practitioner who's fabulous. We also hired a nurse who is an assistant for the surgeries for Dr. Riley and the other doctors in the surgical suite. So we're there. Plus also too, our doctors are now doing injections for pain management, epidurals, where they do facets. They do all types of injections using steroids and sometimes doing PRP. We also have something called an RFA, radiofrequency ablation or rhizotomy, and that burns the nerve root. It's only good for a year and a half, but when the surgery doesn't work or people don't want surgery, it's another option. Also too, for people in that severe pain and need to be taken, there's spinal cord implants. Our doctors have done them, we have not done any in our office, but that's something of a very serious and of course very expensive nature. And we always try to be more conservative than doing that kind of direct stuff as that is. But like I said, it's really great with the doctors, because they're there to work with you. They're there to help you. They're now working as a team. So when one doctor sees something that needs to be seen by another doctor, or needs more testing or more treatments or more specialists. Also, we do have a plastic surgeon who we call in, and he's there to see people. In fact, I had to call him in the other day. Why? Because a husband and wife and their child were at the park, and a bulldog attacked the child in the child's face. And then the husband pulled it away and attacked it, severely ripped and impacted the husband's hand. So the attorney called me up and said, Dr. B, people, I'm not aware of what we can do. Do you know of someone who would take care of it? And I said, well, let us take a look at this and see what we can do, because I don't care who it is. We get referrals from patients, friends, people like you on here. We never know where we're going to get. Well, the husband when he fell down, he had a minuscule tear in his knee. He got a slight concussion. He had nerve damage in his hand. He had to see our orthopedist for the nerve damage in the hand, for the bite and the impaction on the hand and the open wound. Had to see the neurologist where he saw an examination and saw an upper nerve. He also found an MRI where he had a minuscule tear in the knee because he fell on the knee. We also had to call in the plastic surgeon. Why? Because the scar on the husband's hand and where it was severe wound, and also on the child's face. And the parents were very concerned about what was going on and having this impacted. But I said, listen, my recommendation is you need the child to be seen, because that scar is something. And I was looking at our doctor's report, and it was telling us how that will and can impact him, not only as a wound, as a scar, being ostracized by other kids in school and other things. And also too, as a recommendation after he heals, what he can do and how he can help it and get rid of somewhat of it, but not all of it, because it is a permanent nature. And the craziest thing was, when I was speaking to the family, not only they were psychologically affected, but it was amazing to me how psychologically the mother was affected more than anyone else when she saw her child's face being bitten by this bulldog, pit bull, and the husband being attacked. It was just amazing. But the good news is we're getting them treated, we're getting them taken care of, we're having all areas being handled professionally and first class. If they went to any place else, they might have gotten a hand and maybe a plastic surgeon, but not all the different areas that we're handling, because there's other things, and as time goes on, I'm sure we're going to have to check others. Because what happens? What happens is we treat it all. And God forbid if a problem comes up with his back being hurt and he has sciatica, pain radiating down his buttocks into his leg, and maybe even numbness and tingling, it's secondary. The same with neck into the shoulders, down at the arms and hands and fingers. In chiropractic, we do treat that. And a lot of times in the injuries, those are herniations. And we always try to be conservative rather than going aggressive with intervention, pain management, and even, God forbid, surgery. But we're there to help. And sometimes we never know what is going to be involved and what it is. Also, too, Wayne Bracken's watching. Wayne was the head of South Miami Hospital and Baptist group, and what an incredible professional, what an incredible community leader. Wayne, thank you for joining us. It's great to see you're still involved in our community and helping our people as they need to be helped. It's really great. It's great coming that in something like this, that here on Facebook and Instagram, that we connect with people. And also, more important, we're educating people. People need to be educated because sometimes they just don't know where to go. And at Affiliated Healthcare, we're always there. We can't help everybody, but we can help most people with mostly 90% of their problems. And if not, we can try to get them other help. And that's what's needed. People get the injuries and they don't realize what it is. And one of the areas that become a favorite area of mine of doing is finding post-concussion syndrome, or i.e. closed head injuries, also which can be secondarily causing PTSD, just like the football players have. And with our MRIs and our neurologist and our orthopedist and our pain management doctors, we work as a team to help these people, because it's amazing when you get hurt. So many doctors don't have what we have. And the thing that we have for traumatic brain injuries is we have in our MRI called the DTI, diffuse tensor imaging. There's basically only 2 places that do that in Dade County. And I'll tell you, it took me 9 months to get the expert to read it, plus getting the computer program that took the different images so that the specialist can read them. And this guy is a genius. And it's amazing, the reports and what he comes up and what he says and how he kind of designates what's going on to let us know that it's there. And people are not nuts and they're not crazy. But there is a problem there. Also, Norman Sachs is watching. Hello, Norman. It's good to see you too. But listen, everybody. It's been a great morning visiting with you. We're glad to see that you're here with us. You get to see the Pietra. I've never brought her on before, but I figured it was time. And it's one of Dolly's most famous, illustrious pieces. And it's really a kind of cool piece. But I want to wish you everyone a great weekend, a healthy weekend. I want to congratulate my assistant, Anna, my paralegal. Her daughter is getting married Saturday night. So I'm flying up to Orlando. It's my first trip really out of Dade County in a plane. And I'm looking forward to being up there to celebrating that fabulous event that she's been planning for months and wishing for her daughter her whole life. And it's going to be a great evening. So congratulations to her and her family. And it's going to be great. Great people. Her daughter's been great. I've seen her growing up. and she's becoming an incredibly fine woman. So it's great. And I heard she's marrying a super guy, and they'll be a happy family living in Orlando and being happy and raising their children. So everybody have a good weekend. Enjoy it. Let's get out there, enjoy the sun, and have fun. Take care and bye.